Does age really matter when you have a hair transplant? And if it does, why does it matter? Before we continue, do remember to subscribe and click the notification bell so that you're updated with our most recent videos. Hair loss can be a great and very bothersome problem for many people. And right now we'll be talking about hair transplantation in the young person. I'm Dr. Hussain, and I'm the chief surgeon at my hair clinic. So one take-home message is never ignore age. Nearly all the patients that consult with me, sometimes it's in pictures, they don't mention their age. I really don't want to give a final assessment unless I know how old they are. I have to have a good idea. If it's from the pictures very clear they are what their age is, then it's fine. Otherwise, I want their age to be able to say what to do. And what's important here is that hair transplantation in the young, we need to keep in mind that hair loss is a dynamic process. It's not like by the time that most people seek a hair transplantation that they won't lose any more hair. They are very likely to lose much more hair than by the time when they come to see a hair transplant surgeon. Some, of course, have lost all the hair they will lose, but a lot of people call in before they actually have lost everything, and they want to regain what they had just a few years back. So hair loss is dynamic, it's not static. So whatever you are bringing at the time of your consultation may or may not be there in 2 years, 5 years, 10 years. It could be you will not have any hair left in just 5 years' time. And age is an important part of that assessment. Family history is something we use to get a clue about where could we be heading. It's not a final verdict on your future hair loss, but it can give us a clue if, like in my family, my grandfather, paternal grandfather was bald. My paternal uncles, they're all bald. My brothers, they have lost a lot of hair, and as you can see, I've lost tons of hair. And if I hadn't had a transplant, I would have had the horseshoe shape. So the family can give a hint, but it's not a final verdict. And one of the reasons it's not a final verdict is you will see that many, just an example, an illustration of why it's not a final verdict. You can have brothers with different hair loss. So if they have the same parents, but they still have different patterns, it just goes to show that you can inherit differently from your mom and your dad's sides. And we have also, hair loss is also partially environmental, although most of it in men at least is very much genetic, but there are environmental aspects of it. So family history is important. It gives us a clue. We can use it. We can guide the patient and see what do we think it could look like. What is a good estimate of where you're heading. There's some misconceptions that some people believe that you only inherit hair loss patterns or no hair loss patterns from either your father's side or your mother's side. It's not the case. You can inherit from any one of them. Again, it's not dynamic. As you grow older, the risk of hair loss increases. Around 20% of people in their 20s have hair loss, 30% in their 30s have hair loss, and so forth. For men especially, that is a very clear pattern. So the older you are, the greater the chances that you will have hair loss, and the greater hair loss you will have. So apart from these things, also illness and physical or mental stress, alcohol and smoking can impact on your hair and your hair health and your hair loss. Medicines can have an impact. So if you take this patient, if he has some hair loss in the crown, just the slightest, if he's 22, if he has the slightest hair loss in the crown, and do remember, whenever we can start seeing hair loss, we have reached roughly 50% hair loss before the naked eye will notice. But say we have this patient, we don't know where we are heading, we don't know whether the crown will be that big or that big. So if you look at this, say if at age 22, it could be the crown would be like this, the yellow circle in the center here. So the patient comes in and says, doctor, could you just fix me? I'm so upset. My friends, they have good hair. I don't really like this. It's really bothering me. And I'm thinking about it 24/7. And it is a huge stress factor in a young person to have. And I've seen it down to 17, 18 years of age. It is a huge stress factor. But it could be we are helping the patient right now, and maybe just a few years down the road, he might be unhappy about it. Say if this part is the hair loss that the patient has, and at age 20, 22, we do 500 grafts into that. A year later, he'll probably say, doctor, you saved my life. You are such a fantastic person. But maybe age 25, 28, the crown might have developed to this area. And then all of a sudden we need another 1500 grafts, 1800 grafts to go for that. And we're not even talking about the frontal hair loss at all. We're just talking about the crown. But what if he's 29 or 35? Now it could be his hair loss goes down here. We can't say for sure. Family history will guide us. The speed of how fast he's losing hair, whether there's a demarcation line that this is going to be his final hair loss area. But we can't know in many patients. And if we had a transplant into this area at age 20 and into this area 25 and this area say 32, we could end up spending so many grafts in this area that we won't have sufficient for a good frontal look. That is quite important. If you're not having a good frontal look and you have the nicest density in the crown, in your daily life it will bother you. And the most important part of your looks is your frontal looks, or secondly, your side profile. But the frontal look is what defines you. That is what people associate with you. Your crown they might see for seconds. You never have a face to crown conversation for hours. Doesn't happen. But face to crown or the side view being exposed for hours, yes, it happens. So we have to be very careful with the crown especially. The reason I start with that is simply because there is no way I would want to do a hair transplantation to the crown in a person who's less than 35 years of age, unless certain criteria are met. But there are very few. I think in the past 15 years, I've probably done 2 hair transplants to the crown in patients that were less than 30 years old. So that is certainly not something we want to do unless we really know what we're doing and we know why and we feel safe about it. And the reason is, again, it's the uncertainty about future hair loss. It's the uncertainty about total future donor area. Say, if he has this hair loss in the early 20s and we take grafts from this area. So if we take grafts from this area and say, well, this looks nice and good and clean. We have tons of hairs here. Now, if we take this hair and we put it into this. So this hair is going to be lost in the coming few years, 5 years, 10 years, 50 years. So this hair, when it's transplanted into this area, you lose that again. It's not going to survive because it's hair loss prone, it's sensitive to DHT. So that's one issue. So we don't know if the area we're taking, if you're taking from the sides, is it going to actually survive here in the long term? That's one thing. The other thing is we don't know how big it's going to be. So uncertainty about total donor area and the future donor area. We simply don't know where we're going. Aesthetically speaking, the crown is the last priority. Again, what people define, how they define you is from your frontal looks and your side looks. And the front is important because it frames your face. So we need to ensure that we have sufficient amount of grafts for future hair transplantations, for future hair loss in the frontal areas. And I have had many patients that came to me and I told them, please don't do it. And they went to another clinic, and of course there's good money in this, so why not just do the transplant, and the patient can deal with the problems once he's facing them. But this is not the way we should be working. We should take into account that the patient need not be educated about what's going to happen to them, and we need to speak to them about why it is that we should not do a hair transplant. So generally, my recommendation is 35 years of age for transplantation to the crown. There are a few exceptions. And again, it can become very graft consuming, and those grafts could be used in the front. Let's talk about hair transplantation to the frontal area. Say if you have this hairline and you want to just fill in the temples. A young man who is losing hair in his early 20s, he's seeing the receding hairline, the temples getting bigger, and he's seeing his friends having a very nice thick hair and they're styling it. It's just fantastic. They might say, look, I can't accept this. Can you please just lower it? And I prefer to speak to the patient, explain why it is that I suggest we don't lower it. Because say, if we put the hair in here, if we put the hair in here and he loses more hair in the future, we will be forced to put more in. Otherwise, we'll have some a hairline hanging right in the middle of nowhere, and the original hairline has been receding further. So we'll have to play up against the low hairline. And a more conservative hairline in the early 20s, it's advisable. So finally, there's also another aspect. What may look like a nice hairline in your early 20s may not look appropriate in your 40s or 50s, as it looks too low, and you may not it may not fit in with your age. It's not like if you just have a low hairline, it will look the best whatever age you are. It can actually look inappropriate for your age, and it might actually, if it's too low, become kind of a negative feature. So that is also a reason why you should be careful about putting a too low hairline, trying to restore what you had when you were 15 or 18, because it may also not be future proof, even if you don't have any problems with your future hair loss. Even in that case, it will not look appropriate. So this area, any patient, any age, if someone is 15 or 18 or 20 or 22, I would be happy to do this area, even regardless. Simply because, say if you have extensive extreme hair loss, apart from the super extreme hair loss where you have hardly any donor hair at all, but those patients would be hard to help anyway. But far most of patients, maybe 95% of patients, would be able to maintain a hairline in this area, and it will still serve as a framing of the face. So this area I consider in nearly all patients to be safe to transplant to. Obviously, we can have small adjustments in the temples, how they're curving and so on. But the area roughly, this level, this area can be transplanted to in the 18-year-old, in the 25-year-old, in the 30-year-old, in the 50-year-old. Because even if you have extensive hair loss, this is the area we are going to address anyway. I think that's about it. So the area we just took here, we can do it at any age, and even in cases of severe hair loss, we'll address that area, and it is more or less future-proof in nearly all patients. But the take-home message again, never ever ignore age. If your age has not been taken into account, be very careful about what you do then. So that's all for now. Sorry about that. I have called some. So that concludes our videos on hair transplant in the young. I'm Dr. Hussain. Stay tuned for more updates. Subscribe to our channel and click the notification bell so that you know what's happening with our videos. Thank you.